Well, my name is Dr. Cody Wendlandt. I work at Sartell Family Medicine. We have been in business for 2 years now. I am the founder and medical director. We operate what's called a direct primary care practice, or DPC for short. We are a pure DPC, meaning we don't take insurance whatsoever. Now, because we don't take insurance, we can be a lot more flexible, but also we could provide higher quality healthcare that is more personable.
I'm Sarah Shear. I'm a physician assistant. I joined Sartell Family Medicine in April of 2020. I've been a physician assistant though for about 9 years. The time previously allotted for me to see my patients was never enough. When I was seeing patients for 15 or 20 minutes at a time, I wasn't hearing the whole story, and I wasn't helping them with everything that they needed help with. We may have addressed 1, maybe 2 concerns in that time. And now that I'm able to schedule these patients for an hour if they need it, and I can take an hour and we can work through everything they want to work through, has been fantastic. And the other thing is that if I want to see them back in a week, I can see them back in a week, and I don't hear patients telling me, well, I can't afford to come back again because every time I come in here, it's $300 or $400. They're like, yep, I'll see you in a week. And we put them back on the schedule. So being able to offer the patients the complete care that they need, and then the close follow-up that sometimes they need has been really impactful for me as a provider. There are a lot of patients who I see now who have told me that in the past, they wouldn't have gone in for this. They haven't been seen for 3 or 4 years because they just simply couldn't afford it. Whether they didn't have insurance or they had a high deductible plan for their insurance, going to the clinic for something like this just didn't seem worth it to them. So instead of getting the care that they needed, whether it be for themselves or for their children, they were just opting to not get that care. And so seeing those patients in, saying, I haven't been seen in 3 or 4 years, and now I'm able to help them and get them on the right track and get them healthy again, has been really, really fantastic.
I think there's been a change in how people think about medicine, where we've actually had patients come to us and say, I actually enjoy going to the doctor now. It's not something that I loathe or I fear. I like to go see these people. I like to interact. I like to just hang out. We've also seen some of the larger healthcare organizations change their practices based on how we're changing the mindset of the community.
Sartell Family Medicine is innovative because it offers patients, community members, and people in central Minnesota a new option for healthcare and a new way to get their healthcare. Instead of going through their insurance, receiving these bills from insurance companies at elevated rates, they are instead able to pay us a low set rate or a low monthly rate. And so it's saving people who, again, are struggling to pay those medical bills a lower cost, more affordable option, get the healthcare they need, and get the quality healthcare that they expect.